Cholera Outbreak, Bayelsa Faults NCDC'S Surveillance Report by Samuel Oyedonga, Yenagoa. Bayelsa State Government, through its Ministry of Health, has faulted the inclusion of Bayelsa on the list of states affected by cholera epidemic outbreak as recently published by the Nigerian Centre for Disease Control, NCDC, in its Disease Surveillance Report. The Permanent Secretary of the Ministry, Dr. Toyin Azabi, refuted the report at a joint press briefing shortly after a meeting of the Bayelsa Task Force on Immunization and Health Services presided over by its chairman and deputy governor of the state, Senator Lawrence Yerajakpo, in Yenagoa. Recall that the Nigerian Centre for Disease Control had in its recent Epidemiological Week 22, 2024 report placed Bayelsa as amongst the states with the highest burden of cholera cases. Dr. Azabi, who pointed out that there was no confirmed outbreak of cholera in the state in recent times, noted that the NCDC's pronouncement of cholera outbreak in Bayelsa was a total misrepresentation and should be discountenanced as such. She emphasized that all suspected 449 cases of cholera in the state from January to date had turned out negative from clinical laboratory tests, as they were proven to be cases of gastrointestinal diarrhea. According to the Permanent Secretary, the ministry had reached out to the NCDC on the issue, and they had reviewed the state data again and found out that their initial report was incorrect and agreed to issue a rebuttal, which they had not done as at the time of the press briefing. She said, "The NCDC report is a gross misrepresentation of the Bayelsa data, and we have tackled them on it. They have reviewed our data with us and will soon do another pronouncement excluding us as a state with a cholera outbreak." Since January 2024, there have been 449 suspected cases of cholera reported across the 8 LGAs. Importantly, only 2 new suspected cases were reported in the most recent week, indicating no new cases. We are able to even report these cases of watery diarrhea because of our optimized surveillance system across the state. Related news. France reports nearly 200 cholera cases in Mayotte. 1 dies, 5 hospitalized as cholera outbreak hits Ogun. Nigerian newspapers. Death toll rises as Lagos records more cholera cases. Extensive testing has been conducted to confirm cholera cases. Out of 42 rapid diagnostic tests, RDTs, carried out, only 14 returned positive. Crucially, all 14 positives from the rapid diagnostic tests turned out negative when subjected to culture test. Culture tests are the gold standard for cholera diagnosis, and no cases have been confirmed by this method. And this attests to no outbreak. In summary, the cholera situation in Bayelsa State is under control with no culture confirmed positive. The state government is taking active and comprehensive steps to manage the situation effectively, ensuring public health and safety. Commenting on the issue of a dead whale found on the shores of coastal Okpuama community in Brass local government area of the state, reportedly being butchered for food, Dr. Azabi cautioned the people to refrain from the act as it could lead to a serious epidemic outbreak. According to her, consuming the dead whale could lead to mercury poisoning, botulism, and bacteria infections that might prove dangerous to the health of the people. Also speaking, the Director of Public Health, Bayelsa State Ministry of Health, Dr. Jones Stowe, said the state's disease surveillance system was well fortified, noting that all suspected cases of cholera were negative to culture test. On the few reported cases of yellow fever across the 8 LGAs in the state, Dr. Stowe informed that the ministry was taking proactive steps to ensure no deaths and no further spread of the infection. According to him, presumptive positive cases are being monitored closely while the confirmation tests are awaited from Dakar in Senegal. The number of confirmed coronavirus, COVID-19, cases in Africa has reached 4,330,666 as of Saturday, the Africa Centers for Disease Control and Prevention, Africa CDC, said. The Africa CDC, the specialized healthcare agency of the African Union, AU, said the death toll from the pandemic stood at 115,191, while 3,888,495 patients across the continent have recovered from the disease. South Africa, Morocco, Tunisia, Ethiopia, and Egypt are among the African countries with the most cases in the continent, according to the Africa CDC. South Africa has recorded 1,556,242 COVID-19 cases, the most among African countries, followed by Morocco at 500,984 cases, and Tunisia at 268,837 cases, it was noted. Xinhua/NEN says reports a complete misrepresentation of state data.
Let's talk about that developing story from Lagos, where about 5 persons have reportedly died and 60 others hospitalized from the outbreak of severe gastroenteritis in communities that cholera. And joining us is a medical doctor, Odunola Olabinton. Thank you very much for joining us on TVC News at 10. Well, how worried are you about this, and what's your assessment of the Lagos State government handling of this medical situation?
Hi, good evening, and thank you for having me on the news today. I am quite worried about the cholera outbreak in Lagos because the rainy season has just started, and as it is known, cholera outbreaks increase during rainy season, and as we are having cases already at just the beginning of the rainy season, it huge cause for concern because I'm thinking that we might see more cases as the season progresses due to poor hygiene and unsanitary disposal of waste. And pertaining to how Lagos State government is handling it, I think they are handling it well. The commissioner has come out to put out statements, and he has put out emergency concerts to call, and the response to the hospitals have also been tightened. So yes, Lagos State government is handling it well.
Let's talk about the people. What should we know at this time, and what can we do to prevent further spread of this?
Well, we have to know at this point that cholera is a very contagious disease. It spreads through fecal-oral routes. It spreads by ingestion of contaminated food and water. And things that propagate it are things like unsanitary disposal of waste, especially feces, and not having access to clean water. So at this point, we have to know that if anyone has symptoms of gastroenteritis, that is vomiting and diarrhea, maybe fever, they should not take it lightly. They should go to a hospital as soon as possible. Although most people who come in contact with cholera would only have mild to moderate symptoms, please make sure that they still go to the hospital. And home care can include, using oral rehydration solutions, popularly known as ORS, and protect yourself. Please make sure that you wash your hands from time to time. Make sure you don't take water that's not been, cleaned, so like disinfected using chlorine, or you have to boil your water before you drink it. Don't take fruits and vegetables that you don't know their source, or don't eat them raw. Make sure you wash them thoroughly, or cook vegetables as the case may be. Just make sure that you put it.
All right. And what more really can government better equipped to actually cater to the need of people who go there for care?
Well, hospitals at this point need to, strengthen their triage system. So triage is when you go to hospital, they categorize cases by, emergency, non-emergency, and things like that. So at this case, we have to be vigilant in hospitals to recognize that there's a cholera, outbreak, a potential cholera outbreak, and that when doctors, clinicians see a case of acute gastroenteritis, we have to be on the alert. Make sure that the person gets tested for cholera so we know exactly what we're dealing with before they are sent home, and prioritizing these cases and testing them, and also educating them to make sure that this disease doesn't spread.
All right, the medical doctor Odunola Olabinton, thank you very much for talking to us on TVC News at 10.
Thank you so much for having me.
Thanks for tuning in to Smart Okosontv show. Keep exploring, stay curious, and never stop getting the latest information happening around. Don't forget to like, comment, subscribe, and share to keep the intellect flowing. Until next time, keep sharpening, and be smart.